So every day we pick up a toothbrush and we rub our teeth. And also our teeth can rub against each other. We are functioning the entire day, talking, chewing our food. In between, we keep our mouth closed. So when teeth and teeth rub, it gets worn out, starts feeling sensitive, and then we seek sensitivity toothpaste. If not, we probably go to the dentist for help. So when I speak to some patients, I realize that they have slight lapse in their dental awareness. If that had not been the case, they would probably have their teeth healthy for a longer period of time, possibly even lifelong. So the first thing I wanted to emphasize was regarding the brushing. It has to be done with a gentle force, not the vigorous brushing that is done blindly for say 5 to 10 minutes to get a feeling of freshness. That feeling of freshness that we are looking for is basically more often than not our teeth getting aggressively worn. So this is a habit that has to be broken, and breaking a habit is not easy, so a conscious attempt has to be made. Other habits that I would like to bring to your notice is night grinding of teeth, which you might think, do I even do that? This is something which is interesting that you will not even realizing that you're doing it unless the person sleeping next to you makes you aware about it. Another habit that is a problem for your teeth is clenching, which can happen anytime during the day. Whether it is night grinding or whether it is clenching, it is a parafunctional habit which is highly related to stress. When teeth gets rubbed constantly, what will happen? It is going to get worn away even faster and it's going to feel sensitive. So that's when we go buy an anti-sensitivity toothpaste and we feel that it's pretty good. It has solved your problem. What I want to tell you is that the basic thing about your tooth is it has a hard white 1 to 2 millimeter layer which is enamel. Enamel is the hardest substance in the entire body. So if we manage to wear out this 1 or 2 millimeter hard layer, the underlying soft yellowish dentin material becomes exposed in our mouth, and that's when we start feeling sensitive. So how long do you think it will take to wear out your dentin, which is not even as hard as the enamel and having only hardness say about a quarter compared to that of the enamel? So anti-sensitivity toothpaste is not a permanent solution. So I would like to bring to your notice when actually the teeth should contact. Throughout the entire day, teeth should contact only when we are chewing and swallowing our food. So when scientists calculated how long it takes for us to chew our food, so average 3 meals a day, it was calculated that the entire day it amounted up to 17 to 18 minutes. That's it. So the other 23 and a half hours, there is absolutely no contact between our teeth. Even when we are talking, the closest that the teeth can come towards each other is when you pronounce say 6. To emphasize, try saying 66. Even when we are keeping our mouth closed, there is 2 to 3 millimeter gap between our teeth. Always, there is no contact. So when I spoke to some people, when they are closing their mouth, there is always teeth touching each other. That is not a normal contact. It is an abnormal contact that we should consciously try to get rid of. So what about the habits? How can I break these parafunctional habits that I spoke about? So we have to treat the underlying stress problem. So automatically when the underlying problem is treated, this habit is going to go away. But until that is getting treated, we cannot let our teeth getting rubbed and getting worn away. So we could probably get a mouth guard made for us. This mouth guard is basically a plastic barrier that we can wear on our teeth the entire day. It is transparent, it is going to be comfortable, and it is not going to let the upper and lower teeth touch at all. If at all this plastic barrier is what is going to get worn out, then we can probably get it changed because it is quite inexpensive compared to the irreplaceable loss of tooth structure, which is never going to grow back once it is worn out. So if what we have spoken about is applicable to you, you should probably think about getting a mouth guard. That will probably help you stay happy for a longer time, say emotionally and also financially, because if you start going down the road of dental treatment and thinking about getting ceramic caps, there is about 28 teeth in our mouth. That is going to cost a ton of money. Going down the road of dental treatment, that is only the beginning, that is not the end of it. So try to apply whatever I have told you in this video. Stay happy and I'll see you in the next video. Thank you.